Hello, and thank you for tuning into Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people that are making it happen behind the scenes. I'm Dr. Bobbi Pritt, chair of the Division of Clinical Microbiology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Div Dubey of Mayo Clinic. Let me start that again. With me today is Dr. Div Dubey, a Mayo Clinic neurologist and co-director of the Clinical Neuroimmunology Laboratory. He's here to discuss peripheral neuropathy, which can be described as puzzling and a disruptive condition, making diagnostic testing so important for identifying and managing this disorder. Dr. Dubey, thank you so much for being with us today.
Thank you, Dr. Pritt. Thank you for talking about discussing this relatively common but very interesting and sometimes very debilitating condition.
Yeah, I'm glad that we could cover this topic for our listeners. Let's start basics. Can you remind our listeners what peripheral neuropathy is and what's its prevalence? How many people are impacted by this?
So these are a group of conditions which affect the peripheral nerves, which connect the brain or the spinal cord to our extremities. They perform various different functions, including sort of motor functions with sort of movement of arms and legs, sensory functions which control perception of external stimuli such as pain, temperature, etc., but also autonomic functions such as controlling our heart rate, blood pressure. And a lot of these functions can be impaired depending upon what type of nerves are injured or affected. As far as the prevalence among the various neurological diseases our lab deals with, neuropathy is probably the one of the most common, with close to, based on some studies, up to 3% of people or the general population having neuropathy of some kind, varying from sort of mild forms of neuropathy to some unfortunately really severe forms as well. And the prevalence as well as the incidence goes up as people age. So older individuals, people more than 70 years of age, at least using the Rochester Epidemiology Project database, that number can be as high as 10%.
Wow. So, yeah, every one out of every 10 people having this
Correct.
in a certain population. That's definitely significant. So, let's talk about diagnosis then. Why is diagnosing peripheral neuropathy so complex?
I think it's got to do with two main things. One is the varied presentations. As I mentioned, that the nerves perform various different functions, and depending upon the type of neuropathy one has, the presentations of these neuropathies are variable. And then the second thing which makes it complicated is these neuropathies can come from thousands of different causes. So having the know-how as well as the testing opportunity to look for those various causes driven by the clinical clues one a neurologist suspects after seeing the patient is another thing which sort of makes it complicated for us to kind of diagnose these patients. Furthermore, as many of us may be aware, that we use electrodiagnostic studies or EMG as an initial method to test or evaluate these neuropathies. But there are some neuropathies called small fiber neuropathies where EMGs are not useful and they come back to be normal. So those are other sort of variations which can make it challenging for us to diagnose some of these neuropathies.
Well, I'm glad you brought up clinical presentation, studies that can be done in the clinical setting, patient facing providers, but then also the partnership with the laboratory. And that's gets into my next question because it sounds like early diagnosis is important, especially if you have a treatable form of neuropathy. So, what are some of those key signs or symptoms that should prompt our colleagues, patient facing colleagues, to consider any type of advanced testing early in the diagnostic process?
Yeah, one of the very important areas of neuropathy, one of sort of areas which I actively work on is autoimmune neuropathies, where the immune system causes the injury to the nerves or causes neuropathy. Especially in those subset of neuropathies, time is essential. Earlier we diagnose, the earlier we can treat and stop the damage to the nerves. Some of these autoimmune neuropathies affect the myelin sheath, which if you think of your nerves to be like copper wires, it's the insulation which is covering the copper wire which is getting damaged. In these myelin sheath directed immune processes such as CIDP or Guillain-Barré syndrome, earlier diagnosis can actually help rapid recovery because the myelin sheath has the capacity to kind of grow and heal faster than the exons or the wiring inside. Even for some of the axonal neuropathies, such as some of the microvasculitic neuropathies, earlier diagnosis is critical to limit the damage and limit the involvement of the number of nerves. And in terms of what helps us is it's the clinical presentation. So some of the things which are critical is how quickly the neuropathy is progressing. Some of these autoimmune neuropathies tend to be much more rapid in progression compared to a neuropathy that we come across in a patient who has genetic condition causing the neuropathy, such as Charcot-Marie-Tooth disease. Another thing which is extremely helpful is severe pain can be an accompanying feature in some of the acquired autoimmune neuropathies, as well as asymmetric presentation. What I mean by that is not necessarily having numbness or tingling in the toes on both sides, but starting with weakness or foot drop on one side, or weakness or wrist drop on one side, or similarly sensory symptoms just affecting one side. So those are some features which, as neurologists, we take into consideration as we think about the various causes, especially the causes which require rapid action. And sort of the other thing which ends up being very helpful is testing for some of these antibodies and other markers of inflammation, which guide our treatment.
Well, I'm glad you brought that up because let's talk about testing then. So hopefully patients are, when they experience these symptoms, going to their provider right away. And then you talked about the importance of making that early diagnosis or at least suspecting, having a differential and then ordering the correct test. So how do laboratory tests complement or enhance some of your traditional diagnostic tools like the electric diagnostic tests that you had already mentioned?
They are essential and a critical part of our workup and management of our patient. And depending upon the type of presentation, the lab tests we are ordering vary. So, as per some of our American Academy of Neurology guidelines, most patients with neuropathy, even the ones with sort of slower progression, get certain tests done. These include looking for evidence of diabetes, looking for evidence of B12 deficiency, and in some cases, looking for evidence of monoclonal gammopathy, which can be associated with certain types of neuropathy. But beyond that, we look for the type of presentation to guide our testing approach. So let's say if you're seeing a younger patient with disease onset and progressive neuropathy over many, many years, and with a potential positive family history, that sort of guides our testing approach towards genetic causes for various neuropathy, for which Mayo Clinic offers a sort of a panel-based approach, but also provides an algorithm in terms of what to test first and then where to go next. On the other hand, in response to the last question, as I was talking about, if the clinical presentation suggests it's a more rapidly progressive neuropathy where there are signs such as asymmetric onset pain, autonomic dysfunction, which makes us think it might be an autoimmune process, then our lab in the neuroimmunology lab at Mayo offers a wide variety of antibodies which are tested and investigated to help not only guide the diagnosis of an autoimmune neuropathy, but in some instances, an example being neurofascin 155 or contactin 1 antibodies, which also guides the treatment, which tells us what would be the best treatment approach for these patients. Similarly, we collaborate and work with multiple other labs to kind of, again, depending on the type of presentation, to sort of potentially order the right type of test to come to the bottom of what is causing this patient's neuropathy.
Well, I'm glad you mentioned algorithms because you've just mentioned a lot of different aspects like the timing, the onset, how rapidly it progresses. Is it unilateral, bilateral? And as a microbiologist, I always think of things like Guillain-Barré syndrome. And so, was there a respiratory virus prodrome? And so, this sounds like the perfect setting to have diagnostic testing algorithms because otherwise, I could imagine that testing would end up being rather just like broad and perhaps not as focused as it should be. So I know that Mayo Clinic and your laboratory has developed diagnostic labs algorithms for both these acquired and the hereditary neuropathies. Can you share some of the highlights of those algorithms and how clinicians would choose the right tests for their patients?
Yeah, I think as you pointed out, the main reason for offering algorithms is one, optimal resource utilization, because many of these tests are expensive. And then secondly, individually, these causes by themselves are relatively rare, despite neuropathy being relatively common. So, especially beyond genetics, when we talk about antibodies and other tests, if people start ordering these tests in everybody, the risk of false positive results for a relatively rare condition is pretty high. So that's another reason we want to have a targeted approach where people should think about does the phenotype fit for us to offer or order these antibodies? And most of the algorithms are built along those lines with sort of asking providers to categorize patients based on clinical presentation or phenotype and then looking for more common causes first before extending or going on to more sort of esoteric conditions. And then getting clues from other labs which are being ordered as a part of more common part of neuropathy testing to again evaluate patients. So an example being when we talk about genetic neuropathies, one of the common causes is PMP22 deletion duplication for a condition called as HNPP. So one of the areas of genetic algorithm which sort of goes into is if you are suspecting that condition, directly go to that particular test instead of going to the comprehensive peripheral neuropathy genetic testing. Similarly, for some of the autoimmune conditions, if you have clues such as somebody who has evidence of vasculitic process, such as more of a systemic vasculitis. Think about ANCA testing. If you have evidence of monoclonal gammopathy with demyelinating profiles on electrodiagnostic testing, which suggests a particular type of neuropathy called DADS, going directly to that type of test instead of going the more comprehensive route is what we suggest. But in most patients, as when we see these patients in our clinic, all that information sometimes is not available and most patients don't necessarily fall in those sort of small buckets of conditions I'm talking about. And that's where some of the panel-based approach we perform both in the genetics aspect, but also on the autoimmune side, where we cater groups of antibodies to a particular type of neuropathy, allows us to capture these conditions and help diagnose these conditions from the lab standpoint.
Well, I think that's so important what you're doing in your laboratory and creating algorithms and panels that are really clinically useful. So, doing what's best for patients, making sure they get their diagnosis as quickly as possible, and also, like you said, ensuring good test utilization, because otherwise you end up with false positives and that could cause harm too. And so, that's one of the areas I think your lab is really leading in. The other I wanted to mention was your ongoing discovery and validation of specific antibodies associated with neuropathies. I think that's really part of what makes your lab and Mayo Clinic a leader in this space. And so, can you tell us a little bit about these antibody discoveries and how they come about, how they get incorporated into the testing portfolio, and then how do they impact treatment decisions?
Yeah, that's one area of sort of that we are very passionate about, and we have a robust pipeline using various different novel methodologies for discovery of novel antibodies. A lot of this work was started back in 1970s when Dr. Lennon started the lab. But over the last 5 decades, the lab has grown considerably, and there are multiple consultant partners and directors that work closely on sort of building and refining this pipeline for biomarker discovery. And then the most important thing is once we discover these biomarkers, one of our aims is to potentially translate them into clinical tests using various antigen-specific assay platforms such as ELISA, cell-based assays, so that these tests are readily available to people all over the world. And as you pointed out, I think one of our main focuses as we translate these tests is to maintain a very high level of specificity. And in that process, we try to kind of utilize the best possible test, not necessarily looking for the easiest possible way out, which can be translated into clinical practice. Examples being some of the live flow-based assays that we were offering for some of the pathogenic antibodies. Some of these antibodies are not discovered at Mayo Clinic, but discovered elsewhere. But some of these flow-based assays are providing very high accuracy and driving sort of diagnosis of many of these patients all across the world.
Well, thanks, Dr. Dubey. That's really inspiring. And I think your lab is one of those that at Mayo Clinic just really takes the whole translation from research to actual clinical implementation. And it does it so well. Well, we've covered a lot in a short period of time, but is there anything we didn't cover that you think our listeners would like to hear more about?
So I think peripheral neuropathy is such an important and relatively common condition that as clinicians while covering these patients, seeing these patients, the peripheral nerve side, we recognize that just giving a diagnosis is not enough. we need to have a multidisciplinary approach where the neurologists work closely with the laboratorians, but also with other subspecialty groups such as the physical medicine and rehab clinicians, so we can not only diagnose and in some cases treat, but even in patients where necessarily we don't have treatment which is going to reverse the neuropathy, provide symptomatic care to help their pain, their disability, their foot drop through various different methods. And that is sort of an important aspect that the peripheral nerve clinic focuses on while managing some of these patients. And then the other thing, the important thing is as our understanding of these neuropathies evolve and that basket of idiopathic neuropathies where we don't exactly know what's going on continues to shrink thanks to the tests which are being brought up by various labs at Mayo Clinic, I think innovation and application of that diagnostics into and translating that into clinical tests and then translating that into research which helps in better understanding and better treatment of these neuropathies is critical.
Well, it's very inspiring, and I really appreciate you taking the time to join us today. It's a very interesting topic, and it spans so many different areas, even microbiology, which, like I said, is my area, and infectious diseases. And the fact that it's so common, it's something that I think it just impacts a large number of people. So it's really rewarding to know that you and your lab and your colleagues are working on these important conditions.
Thank you, Dr. Pritt.
Well, thank you again for joining us, and it was great speaking to you. Maybe we'll have you back on in a future date to talk more about this.
Sounds good. Thank you.
Thank you for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and tune in every other Thursday for new episodes.